I'm speaking with Dr. Pete Vincent of a travel clinic at Takai Medicross Hospital in Takai, Cape Town. Good morning, Doctor.
Good morning, and good morning to all your listeners.
Thank you. Let's get straight into it. Malaria. What exactly is it and how do you catch it?
Malaria is a protozoan parasite that's transmitted by female Anopheles mosquitoes, and the important thing to know is that they're dusk to dawn feeders, so they're basically midnight feeders, and so that's the time that you have to protect yourself. And the big lesson to learn is if you don't get bitten, you won't get malaria.
Okay, so they bite you and it's mostly in the evenings.
That's right.
And early mornings as well?
Early mornings as well. Dusk to dawn, you should have sort of protection.
And during the day?
That's more dengue biting mosquitoes are daytime, and quite often the areas of dengue, fever and malaria overlap. So one should, in lots of cases, know where you are, whether you should be taking malaria prevention measures during the day as well. But generally malaria areas, preventive measures are from sort of dusk to dawn, where you should be covering up, wear lightweight long pants, preferably light coloured, and long sleeves, and using DEET as your main.
Let's get on to that in a moment, but we're just curious because we get many questions about the different types of malaria. Are there different types?
There are four different protozoan types. There's Malaria falciparum, which is endemic throughout Africa, and that is the real serious form where you can end up getting cerebral malaria if it's not diagnosed early and treated quick enough. So falciparum malaria, which is in Africa, is the dangerous form, and that is why you should be taking malaria prophylaxis and preventive measures if you do come to certain African areas. There are also in Africa, there are the Vivax ovale and Plasmodium malaria, and down in East Asia, there's one called no-leasy. That's the fifth, but it's very rare, and that's transmitted from monkeys to humans.
Okay, but that's not applicable in the Africa.
It's not really applicable in the African context at all.
Okay. Does every malaria develop into cerebral malaria? Because I understand that's the most deadly kind.
No, cerebral malaria is just a complication of malaria if the malaria is not diagnosed and treated correctly and quickly enough.
If you are unlucky enough when you come back from your holiday, like many of our American visitors and European visitors do, and they come back, and what are the symptoms that they know they have malaria?
Any fever, generally it's fever, flu-like symptoms. You can have vomiting, cough. With little children, it's feeding sort of changes, and just in general, it's generally any flu, but any fever coming back from a malaria endemic area requires a blood test to exclude malaria. It can be a life-saving blood test. So if you come back from a malaria area and you've got fever at any time from 10 days to 3 to 6 to 9 months after the visit, you must tell your doctor you've been to a malaria area and demand a blood test, and also follow up the result of that blood test.
So how do you distinguish it from a common cold or a flu?
Sometimes it can be quite difficult. Generally the fevers are higher, sweating is quite a part with rigors, so sweating certainly does come into it. But generally any fever on a return from a malaria area should be regarded as malaria, and just have a blood test to exclude malaria.
So it's vitally important that you tell your doctor.
Very, very important. That's really the most important lesson I think to be learnt from this interview.
Okay, so have a blood test and tell your doctor.
And follow it up and exclude malaria at the first instance.
Okay, we touched upon it earlier. What are the precautions and preventatives we can take?
Okay, the big thing is if you can stop them, mosquitoes biting you. So if you wear lightweight long pants, lightweight shirts, because remember you're going to be in the tropic areas, where the last thing you want to do when you won't have your sundowners is to start covering up your skin, and then to put on a DEET-containing lubricant, which will disorientate the mosquitoes, and you can also use fabric sprays as well. containing permethrin, and they can go onto your cuffs, collars, and onto your leggings, and also very useful to put around your bed and curtains in your room. And if you're going to sleep under mosquito nets. Make sure the mosquito net is properly tucked in around the bed. Make sure there's no holes. And impregnated mosquito nets are best. And also, a lot of these rooms have fans, so sleeping under the fan also reduces the possibility of getting bitten by a mosquito.
Okay, and just touching again upon the sort of drugs or anti-prophylactics, what is available and what is recommended now in modern medicine?
In Africa, we are chloroquine resistant falciparum malaria species, so there's only 3 alternatives that we have for prophylaxis. That is Malinol, or is known as Malarone overseas. That's an expensive thing, but it's called a schistosant because it actually kills the liver forms. It can be taken for much less of a time than the other 2 forms. And that you take one a day before you enter the area, and then daily, and then for 7 days afterwards. The doxycycline, which is the antibiotic, can make you a little bit sun sensitive. Must be taken with a full glass of water. Also can be taken the day before you enter an area and daily while you're there, but it must be taken for 4 weeks afterwards, because that just works on the blood form, and so it waits for the liver to be totally depleted of the strizons in the liver, and that's why you've got to take, very important to take it for 4 weeks after you left the malaria area. And then the last one is Larium, which is very effective. It's a once a week tablet. You should have 2 doses before you enter a malaria area, and then weekly while you're there, and then for once a week for 4 weeks afterwards. But it has got a bad name because occasionally, if you've got any psychological problems, it brings them to the fore.
Okay, and those side effects that you mentioned before, free drugs, those are the only side effects?
Those are generally the only side effects. The Malinol sometimes does have, can cause a bit of an upset tummy, but people react to all 3 of them, and sometimes it's worthwhile having a test dose just to see how you go, especially with the Larium. Quite often, because you've got to take the Larium at least a week beforehand, to ask our clients to take 1 dose and see how they feel. But generally, if there's any history of any psychiatric problem, any sleep disturbance, we would prefer the other 2 to be taken.
And for children?
Children, both, there's a pediatric form of the Malinol, which works very well according to weight, and I think up to 40 kilograms you'd be ending up taking sort of 4 tablets. It's very bitter and best to be given with condensed milk or jam, and that's also to be taken on a daily basis like the adults. And then Larium or mifloquine has got a pediatric formulation, and it's registered from 5 kilograms upwards in weight, and that generally works very well.
Okay. Is there anything else you'd like to add generally about malaria and what's happening with it?
The very important thing is that a lot of people try and stay away from taking prophylactic drugs, because there's a story that if you take prophylactic drugs, then you mask the symptoms of malaria, which is absolute nonsense, and really it may just make them less, but the malaria will come out if you have been bitten by an infected malaria mosquito, and the prophylaxis hasn't been sufficient to wipe it out. But it's very important that you do take the prophylaxis, that you don't listen to the habits of the country you're going to. It really is can be a death sentence if you don't take the proper precautions.
Sorry. Yes, I'm saying, so you definitely recommend, if you're going into a malaria area, to take anti-prophylactics, to take drugs.
It also depends on the length of stay, where you're staying, and what accommodation you're staying. Because obviously, if you're tenting next to the river, you're at far more risk than you are if you're staying in a 5-star hotel. So everything's got to be sort of weighed up. But generally, one would advocate, if you're going into a malaria area, taking malaria prophylaxis.